Hi, my name's Jennifer Mathias. I'm a hand and upper limb therapist. My passion, my interests, my specialty is in hands. I started my career in 1993 as an occupational therapist. I worked in a general rehabilitation centre. It was a really important stage of my career because it really made me appreciate how somebody can have an injury to one part of their body and yet it impacts on so many factors such as their psychological state, their family, their roles, their work. I then went on and worked for the next 15 or so years in a couple of acute public hospitals in Melbourne. It was at the same time that I started up my private practice. I always remember being in outpatients at one of the hospitals that I worked at, and I was chatting to one of Melbourne's leading hand surgeons. He said to me, you could go on and do further study and be a doctor, or you could go on and do further study and be the very best hand therapist. So that's what I chose to do. From there, I went on and did a postgraduate diploma in hand therapy and upper limb rehabilitation. I graduated with honours and I really enjoyed that course. I enjoyed the subjects such as tissue injury and repair, histology and pathology. It certainly made a big difference in my future career. What I love most about my work is working with patients. Not only working with those patients that are really highly motivated, but also working with the patients that are struggling. I truly believe that I can help those patients. Sometimes it takes more than me. Sometimes we need to surround ourselves with other professionals to help us. So we may need to draw upon the resources of a psychologist, a hand surgeon, GP, return to work therapist. I just think whatever it takes, we'll surround ourselves with those people in order to get the absolute best possible outcome. Melbourne Hand Therapy started in 1996, and since then it's really grown organically. It's grown as we've needed to take on the resources to assist the patient and to get the best possible patient outcome. I realised my own limitation, and although I love hands, sometimes patients present with really complex wounds. So that was the first person I took on, was a therapist who also had a nursing background. Sometimes patients have problems and it radiates more proximally up their arm. So then I took on shoulder physiotherapists. I'm pleased to say those members are still with me today. One of the most important parts of Melbourne Hand Therapy is that we surround ourselves with like-minded therapists. Therapists that really care about the patient. Often I get a phone call and a therapist said that they've woken up overnight because they're worrying and thinking about a patient. To me, that just shows that they care beyond working 9 to 5. And I think that really is one important factor that sets us aside. I love being surrounded by therapists that truly care about their patients. They care that their patients do well. They care that the patients get the absolute best possible outcome. To achieve the absolute best possible result, we have longer appointments. We don't charge TAC or work cover patients any out-of-pocket expenses. We do whatever we can to ensure that they get the best outcome. I really love my job. In fact, I don't really see it as a job. I love working with patients, I love working with surgeons, and I love surrounding myself by a team of like-minded therapists. I share this passion through lecturing and running workshops to occupational therapists and physiotherapists. In saying that, after 25 years, I still attend surgeons conferences or hand therapy conferences, because I think we can always learn. I know that my therapists also have the same passion that I have and have the same level of expertise and clinical experience. We certainly would love to help you if you need it. So we look forward to you making contact with us. Thanks for listening.